Welcome to MLT case study series 4. So today we'll discuss about a case study with a rare encounter of Bombay blood group. So this case study delves into the discovery and management of patient with a rare blood type called a Bombay blood group. So this case study will shed light on its significance and transfusion in medicine and genetic inheritance. The Bombay phenotype characterized by absence of antigen A, B and H antigens on the red blood cells, posing an unique challenges in blood transfusion and requiring meticulous attention. By the way, in India, this is 1 in 10,000 people in India having this issue. This has been first time discovered in Bombay. So hence it is called as Bombay blood group. So this means these people with this rarest blood group cannot receive blood from any other people. Rather than these people can only receive blood from same Bombay blood group individuals. Hence this is one of the rarest blood group around the world. So objectives, what viewers will learn upon finishing this lecture, viewers will understand about genetic basis and epidemiology of Bombay blood group, the importance of precise blood typing in transfusion medicine, management strategies for patients with rare blood types, and the role of molecular diagnostics in identifying rare phenotypes. So a quick overview about Bombay blood group. We know that red blood cells have two types of antigens. Either red blood cells has A antigen or red blood cells has B antigen. If they have A antigen, then it will be A group, B antigen B group. If they have both A and B antigen, then that will be a AB group. And if they don't have A and B antigen, then they are called as O group. But we are always forgetting one important thing here. O group individuals still have an antigen called H antigen. All of us, even though we are O group individuals, we still have an antigen called H antigen. That means H antigen is a common antigen present in all of the blood types. That means A antigen will be AH antigen, BH group, ABH group and OH group. That means we all have H antigen. But in a very rare condition, this H antigen is absent. In some individuals, this H antigen is absent and they are our Bombay blood group individuals. See, in Bombay blood group, the H antigen is absent, right? In all other blood groups, H antigen is present. ABH, ABH, AH, BH, BH. Even in O group individuals, they have H antigen. But whereas in Bombay blood group, the H antigen is absent. That is why Bombay blood group phenotype is also called as HH blood group. Since they don't have H antigen, they are called as HH blood group. Okay. So this is the difference between a normal O group individual. So a normal O group individual will have H antigen, whereas a Bombay blood group individuals, they don't have H antigen. So with this preliminary knowledge, we will go further. So today's patient is a 30-year-old male. He has presented to the emergency department with the symptoms of severe anemia following a minor surgical procedure. Relevant medical history includes no prior significant medical history. However, there was noted a difficulty in previous blood matching for a relative, suggesting a possible genetic link with this patient. The clinical presentations, the symptoms of the patient include fatigue, pallor and shortness of breath, and also physical examination findings found that there is a generalized weakness in the patient, tachycardia in the patient, that means increased heartbeat in the patient, and pale conjunctiva were noted, indicating a state of anemia in the patient, that indicating he must need a blood transfusion. For diagnostic approach, the tests ordered include CBC, complete blood count, blood typing, antibody screening, cross-matching by specialized serological tests to be identified for any other phenotypes has been ordered. And initial findings has observed that in the cross-matching, we know that cross-matching is two types, major and minor cross-matching. In major, donor cells will be combined with a patient serum, whereas in minor cross-matching, patient cells will be combined with donor serum. So in this case, we have identified a disparities in the O group individuals. Okay, the donor cells has mysteriously reacted with the recipient blood. Recipient serum has been, that means patient serum has been reacted with the donor cells even though they both are O negative individuals, indicating patient having some abnormal antibodies. So what we suspected, we thought the patient might have anti-H antibodies. So immediately we brought anti-H anti-serum and we added anti-H anti-serum to the donor cells. Okay, that means normal individuals, when we add anti-H antiserum, we will get agglutination, indicating they have H antigen. But whereas in Bombay blood group individuals, the H antigen, upon adding H antiserum, they didn't get any agglutination. That means these patients don't have H antigen, indicating these are Bombay blood group individuals. So immediately after adding H antisera, we have identified that this patient is a Bombay blood group individual. Right? So differential diagnosis, we also went with why the patient has this abnormal antibodies, but upon clinical history, we identified there is no linkage of erythroblastosis phenomenon since the subject is a male. So we have concluded that this patient is a Bombay blood group individual. So the final diagnosis, the diagnosis of Bombay blood group was confirmed through specialized serological testing and molecular diagnostics, highlighting the importance of comprehensive testing in case of anomalous blood typing results. So whenever there are issues with cross matching, immediately we will go with this advanced blood grouping test, and we identified that this is a Bombay blood group individual. So the treatment and management, outsourcing Bombay phenotype blood group is the only option. These people can only receive blood from other Bombay blood group individual. So thankfully the outcome is very successful. The patient successfully received a transfusion of Bombay phenotype compatible blood and showing significant improvement. So discussion, key learning points, the critical importance of accurate blood typing and awareness of rare blood groups in transfusion medicine is paramount of interest. The necessity of maintenance of rare blood group registries for emergency situations and molecular diagnosis plays a crucial role in identifying rare phenotypes. Relevance to the medical lab technology practice, medical lab technologists must be adept with recognizing and investigating unusual blood typing results. This case underscores the vital role of medical lab technicians in patient care, particularly in the context of managing patients with rare blood types. Thank you very much.